Welcome to the Gilded Age and Progressive Era, a podcast about the United States and the world in the late 19th and early 20th centuries. I'm your host, Michael Patrick Cullinane. Almost a year ago, this podcast began with a show about the 1918 Great Flu pandemic. At that point, we were reopening after lockdowns, and we were also pre-Omicron. We didn't yet have the strain that reignited all these fears about further lockdowns and contagion. But today, a year later, many places still have high rates of contagion and yet have ended mask mandates and seek to put the pandemic into the rearview mirror. Now, that said, there are places that aren't reacting that way. China has only recently introduced lockdowns, and zero-COVID places like New Zealand are grappling with community outbreaks. So is COVID over? And COVID, can it ever be over? How do we react to the changing virology and the social norms? When I interviewed Chris Nichols a year ago about the Great Flu, we had yet to consider how a pandemic ends, or if it does. We didn't really reflect on how the Great Flu ended, or if it did. So when Chris suggested we come back to talk about the Great Flu, I couldn't think of a better idea. Chris has recently been part of a roundtable discussion called What Came Next? Reflections on the Aftermaths of the 1918-1919 flu pandemic in the age of COVID. And that was a discussion at one point, really, but it was also published in the Journal of the Gilded Age and Progressive Era. So it's out there. It's only recently been published, and you can get a handle on that. But today on the podcast, what I've done is I've invited 3 of the participants of that roundtable to discuss their reflections. And that was really Chris's idea, so much credit is due to him. I'm joined today by Chris, of course, who listeners will know from the first episode. He's professor of history at Oregon State University and director of the university's Humanities Center. He's also the author of a wonderful book called Promise and Peril, America at the Dawn of a Global Age. And he's also brought together a number of scholars for some amazing collaborative books, like A Companion to the Gilded Age and Progressive Era, and 2 recent books, one, Rethinking Grand American Strategy, and Ideology in U.S. Foreign Relations, which is due to be released in the coming months. Joining Chris is Maddalena Marinari, professor of history, peace studies, and gender, women, and sexuality studies at Gustavus Adolphus College in Minnesota. Maddalena is an expert on immigration and the author of Unwanted, Italian and Jewish Mobilization Against Restrictive Immigration Laws. She's also co-edited a wonderful book called A Nation of Immigrants, Reconsidered, U.S. Society in an Age of Restriction, which, along with her monograph, makes her the leading scholar on migration in a period of restrictive quotas. We also have David Huyssen, senior lecturer of history at the University of York in the UK, an urban historian and an expert on economics and labor. He's the author of Progressive Inequality, Rich and Poor in New York from 1890 to 1920, which gives us a wonderful, if not disturbing, picture of the gross inequalities and labor strife in New York City during those years. David's work gives us much more of a realistic picture of the Gilded Age and Progressive Era cities, and one that Julian Fellows might want to think about for his next season of the TV show. Welcome to the show, everyone, and welcome to our first group podcast.
Thank you for having us.
Thank you.
I knew that was going to happen. We were all going to crash into each other. And this is the first experimental 4-person podcast. So it'll be interesting to see how this all comes together. So today we're talking about COVID, and we're talking about the 1918-1919 flu. And I'm reluctant to say that we're at the end of COVID, although it does feel as though there's some degree of normality returning, at least in phases. But as we transition from pandemic to endemic, can everyone share your thoughts on the end of COVID and the Great Flu? I mean, how does it happen? Does it happen? And what have we learned? And maybe we'll start off with Maddalena.
Thank you. So I think, as I mentioned in the roundtable, it's if you look at both the end of the flu pandemic and the end of COVID-19, it's really different if you keep immigrants, refugees, and asylum seekers in mind, right? Because these are places that have been ignored and left unprotected from the very beginning. So I hope it's not surprising if I mentioned that outbreaks are still fairly high among these populations. And I think the war in Ukraine, so this is an update on the roundtable, right? The war in Ukraine is further exacerbated, right? I think it's striking to me that there is even no mention. And so I feel like my one contribution can be that while there are pockets of societies that feel or seem like they're going back to normal, that is definitely not the case for immigrants, refugees, and asylum seekers, right? And one of the commonalities that I see between then and now is people not reporting for fear of being scapegoated, or higher death rates because they have little to no access to healthcare. There are economic concerns, and in the US in particular, these seem to be particularly true with the vaccinations. The language barrier and the lack of trust toward government institutions is very high, and I think that's complicated any effort, right, to either share information or promote vaccination, right? So in 1918 and 1919, we know that, for example, very little of the literature was even translated. And so communities were fairly isolated and had access to very little knowledge. But I could keep going, but I'll stop there and turn it over to maybe Chris.
Yeah, sure. So I guess my take would be, I think that's really useful to think about sort of pockets of communities, or the different ways in which later stages of a pandemic are experienced differently by across the same society, much less across nation states. I suppose one thing that I would emphasize is that, sort of the history of pandemics, and certainly 1918 and 19 suggests that the endemicity or an end or an aftermath is really in the eye of the beholder. And it's not something that's biological or epidemiological, but really psychological and political. That's certainly what we've been seeing the last year or so, right? And it's what you see in 1920, where the fourth wave in the US was more deadly than the first or the third, for instance. In 1920, you see lots of deaths globally from the flu, but you see plenty of societies beginning to live with this much higher mortality rate from a virus moving across borders and through populations. So, we have a very different sort of medical, sociological, and political context today, but that is a sort of fundamental truth, at least for now, that it's political and psychological, that the end is the sort of thing that Maddalena is suggesting, right? That you're forgetting, in some societies, we're forgetting people who are more at risk, just as we did in the beginning of this pandemic, but in different sorts of ways now that we've got vaccines and medical treatments. And I think looking out to the future, the sort of directionality we can see from the pandemic of 1918 and 19 is that, it's not until about 1924 that flu virus takes on the characteristic sort of seasonal flu components that we think of today, where it affects the youngest and the oldest in the population. Up until about 1924, it was still affecting the healthiest people in society. And nevertheless, societies were living with it and living with these higher mortality rates. That may well be what we see. And that's one of the conclusions of several people in the roundtable, that we're looking at an ongoing pandemic or epidemic or endemic viral transmission moving forward for quite a while.
Yeah, I'd agree with Chris and Maddalena both, that there is this sort of, I think what you're both kind of getting at is rather than an end of the pandemic, what you have is sort of combined and uneven experience of the pandemic. To borrow a phrase from political economy, one of the things that I've started thinking about the end of this pandemic or the aftermath of this pandemic is that it's not, drawing from this essay that I cited in the roundtable from Douglas Almond, is the 1918 influenza pandemic over, which, was published in 2004. And he essentially says, no, it's never ended. Is that really what happens with pandemics, is that they get subsumed by, rather than end, they get subsumed by the politics and the economic developments of the moment that they're in. And the way that takes shape in 1918, 19, and then 1920, 21 is, I think, different in important ways from the way it seems to be taking shape now. There are a lot of superficial similarities, sort of, the growth of inflation, eating away at paychecks, labor uprisings of labor militancy, really during the pandemic. Actually war in Russia. There was the Russian Civil War going on at the same time, which is affecting global economic flows in a variety of ways that sort of interestingly enough there's sort of an opposite phenomenon because the U.S. was still just becoming a majority urban country in 1920. It still had such a powerhouse of agricultural production that the U.S. was actually sending food aid to Russia in the early 1920s, rather than worrying about food prices as we are today. But one of the things that I think you do see is that those kinds of politics, the political developments of the end of World War I, and the geopolitical considerations of Woodrow Wilson's sort of ending of the war take up more space in the public mind, because in part the sort of impetus for that happened first. That is ultimately, I think, what happens in 1920-21. You get this sort of rapid deflationary policy from the Fed and the Federal Reserve of New York, and it spikes massive unemployment, which we still haven't seen yet in the so-called aftermath of COVID, although it may be coming. We'll have to see. The latest inflation numbers seem to indicate that inflation might have peaked last month and is just starting a slow decline, but it's really too early to say, I think.
It's incredible, the parallels, whether it's the politics, the warfare, the agricultural fallout, and inflation. I mean, it's remarkable. And yet there's a big difference, isn't there, about how we experience the two. Remote working has really probably saved the economy in so many ways. And also the data that we use seems to be ever changing as well. And as historians, these are our primary sources, right? So what has the data shown us now that I talked to Chris at the beginning of 2021 about the pandemic, and we were talking about data like, cases and deaths. And now we have all these different data points. What have we gained or lost with all of these metrics? And I might start with you, David, then work our way backwards.
Yeah, I mean, I think I spoke about this a little bit, or wrote about this a little bit in the roundtable. My feeling about it is that as much as has been gained by an ability to kind of analyze and respond to problems quickly, and on an empirical basis, hypothetically, there's actually a sort of tendency toward dependency on particular kinds of data that can then inhibit a comprehensive or swift response. I know a lot of the sort of popular media literature around the question of school closures, rather than sort of seeing schools as generally indoor spaces where lots of people are running around in close proximity to each other. When people were debating about mask mandates, there was this sort of demand from more data-driven scientists, or in many cases actually economists who were masquerading as epidemiologists. We need to have more data before we can take action on mask mandates, and so it seems like this dependence on data sometimes produces a kind of paralysis and an inability to act on the basis of deduction, and deduction from science that is epidemiological science and immunological science that is much more well developed than it was in 1918, 1919. And yet we still, seem to be facing a lot of the same problems with misinformation and misguided policy.
Yeah, I think that's a really interesting point. I like the way that you make it in the roundtable, David. One element of that is something that we did see in 1918 and 19, which is this sort of valorization of the economy and this false dichotomy of the public health versus the health of the economy. And certainly there were medical professionals, there were economists, and there were politicians who made that case then, which sounds eerily similar to today, despite the massive amount more data we have now and capacity to actually interrogate those questions. Nevertheless, that, the politics of that, I think is maybe the more interesting way of thinking about this, in the way of your question, Mike, which is to say, there's one element here, I'm thinking about the science of wastewater testing. A lot of campuses and universities did great wastewater testing, including mine here at Oregon State. We could figure out where there was going to be an outbreak and quarantine a dorm in record time. And then that proliferated through different communities. But of course, the politics of that were quite different. So as Maddalena will undoubtedly, note, right, if you look at immigrant communities, if you look at refugees, if you look at people of color, right, these communities maybe don't want to be surveilled in the same sort of way that college students want to be surveilled or can be surveilled, even if they don't want to be. There's one element there, just thinking through some of the dimensions of the data we can develop and then how we can act on it. That's another crucial question. You saw this in 1918 and 19, and it's been, for me, vividly clear lately that, we, just because we know what David was mentioning, right? We know that having a whole bunch of kids in a school with poor ventilation is just bad for viral transmission. They knew that in 1918 and 19. A lot of schools practiced ventilation. They taught outside. There's amazing photos of people learning in snow. And nevertheless, plenty of school districts stayed wide open with no masking, right, in 2020 and 2021 and 2022. So how useful is that information if people are unwilling to act on it? That would be my fundamental question. And I don't think it's that different between these two pandemics.
I couldn't agree more, right? I think it's useful to frame this information in terms of, as Chris just said, the politics of this data, right? We really probably have all the information we need to act, to contain, prevent, right, or limit spreads, but we have decided not to. And I think, or we decided not to fully believe this information. And I think when it comes to immigration, that's a really good example, right? So domestically, there's a lot of skepticism or mistrust, right, of why this information is being collected and what it's used for, right, as a surveillance mechanism. And earlier on, right, despite plenty of evidence showing that some of these communities, because of their health history, the lack of healthcare access, were some of the hardest hit, right? You also had the emergence of the myth of the essential worker, right? It didn't matter that they were exposing themselves and exposing their families to the virus. We just absolutely needed them. But I think the discrepancy between collecting the data, what we're going to do with it, comes also what happens at the border, right? The Trump administration pushed Title 42, which is still in place under the Biden administration, and a lot of politicians on both sides still want to keep as an effective measure to control the spread of COVID-19, right? Title 42 essentially is a public health order issued by the Center for Disease Control and Prevention to close travel to non-essential workers, migrants. And does it work? We have plenty of evidence that it does not, and that rejecting especially asylum seekers and refugees and keeping them in these overcrowded camps has actually led to outbreaks, right? And so in this case, I think it's a really good example of seeing the gap between, we have this information, we're collecting this information, we know exactly what's going to happen, and refusing, right? Because it's easy to it gives you a veneer of action, it gives politicians a veneer of action, and it's geared towards a population that is already marginalized and historically scapegoated, right? And it actually happened in 1918 and 1919, despite the fact that the rates of infection were not higher in immigrant communities than in native-born communities. That was completely ignored, right? There are communities that were completely isolated, walled off, where people couldn't go in, food couldn't go in. And so it still amazes me, right, that much of the rhetoric and how this information is used hasn't changed 100 years later.
That's a really useful segue for the next question I have, because I think what we're really talking here about is about forecasting and about the trajectory that things are going, the direction of travel that things are going. And I suppose expectations is really what I want to get to next, because when I had first talked to Chris about the flu and COVID, it was September 2021. It was just before the Omicron wave. It was coming, and the lockdowns in China are now here, and all the supply chain failures, they hadn't quite happened yet. How does the pandemic shake up our expectations about normality? Maddalena, do you want to pick up where you left off? Because I think what you were just about to, if you're talking about immigration, and you're talking about the lives of communities that are maybe not always in the limelight of people's, their consciousness all the time. What are the expectations about where things go from here? And what about during 1918, 1919? Where did things improve? I mean, was this, what was the direction of travel?
So in 1921 and then 1924, so we're about exactly 100 years away, the United States passed the most restrictive immigration law in US history. It almost completely banned immigration from Asia. It severely restricted immigration from Eastern and Southern Europe, and it imposed new restrictions on the travel from the Americas. They were exempted from these larger restrictions, but there were other ways in which they were policed. And it's not by chance that 2 days later, after the passage of the 1924 Act, the Border Patrol was created. And so it's interesting to me that one of the consequences, the aftermath of 1918 and 1919, and then today, is a closed off wall. The world, essentially, right? Where one of the immediate reaction is to contain travel, even though goods and ideas travel fairly freely, right? Because now we have 100 years worth of policing control, but also controlling and scapegoating, we're even more closed off now, despite the fact we have plenty of evidence that shows that borders don't stop these viruses, right? And so then, like now, you have an even further criminalization of immigration and movement, but also the return of violence, right? Which is always lingering. I think I use this word, I'm shocked that attacks against Asian Americans in the United States have completely disappeared from any coverage, even though they're still happening, right? In 2021, compared to 2020, there was a spike of 300%, and that hasn't really gone down, but somehow even that violence has become normalized, right?
Which is, of course, part of a wave of increasing white supremacist violence in the United States more broadly, not just against Asian Americans, which obviously had this sort of propagandistic connection to the idea of the spread of COVID as the Wuhan virus or the China virus or whatever, but also against Black Americans, against Latinx Americans, and against immigrants. And of course, this is one of the clear parallels between the aftermath of 1918, 1919, and the COVID virus today, is this rise in the virulence of white supremacist violence. I think the rise of the Second Klan, the consolidation of systems of Jim Crow violence, all of the in addition to this most restrictive immigration policy in the history of the United States. These are unfortunately dynamics that we do seem to be reckoning with in many of the same ways. One sort of small note of hope that I'd like to sound, even as I fully acknowledge the reality of, and in particular, I think how frightening what Maddalena is saying, given the enlarged capacities of state violence in the United States in the last 100 years. I do think that the level of we're in a slightly different political moment right now in terms of the alliance between the state and a resurgent big business in an attitude toward really excessive repression of, excessive repression, any repression is excessive, but the repression of of anti-capitalist workers' movements. This was a real sort of signature element of the political dynamics of 1919 to 1921. I think there is, of course, in many ways, a much more hobbled form of labor militancy right now in the United States than there was at the beginning of the 20th century, after decades and decades of labor uprisings through the Gilded Age and the Progressive Era, as many of your listeners will know. But I do think that there are also some small glimmers of hope in terms of the unionization efforts of some of those service employees and retail employees that I was not referring to in the roundtable, that I think Alan pointed out rightly, more regularly characterize employment in our own day than they did in 1918, 1919. The Amazon warehouse on Staten Island, the Starbucks locations that have been unionizing pretty steadily over the course of the last months. And one hopes that one will see a sort of more general coalescence of working class militancy, perhaps also in response to some of the realities of the pandemic, particularly in terms of care work in nursing homes, which is some of the most exploitative labor in the United States right now, and a major component of job growth as the baby boomer generation approaches the moment where they will need or are needing that late life care.
I'll just interject briefly to say that's where I see some hope as well. I think there are more interracial coalitions than we saw 100 years ago. This group were, systematically and intentionally separated and pitted against each other. I think because this is a specific moment about racial reckoning in the United States as well, that there's more potential of these coalitions with similar interests, but who have operated separately, right? So that's my glimmer of hope that I wanted to share.
I appreciate both of you having some glimmers of hope here in the midst of our historical parallels to, enormous immigration restriction, rising violence, economic dislocation. I mean, just to be really specific for listeners who don't know, right? The summer of 1919 was often referred to as Red Summer, not because of its anti-communism or anti-radicalism, although there was plenty, but because of the bloodiness of the summer, because blood ran in labor actions, the Great Steel Strike in Seattle, the Boston police go on strike, right? There's tons of race massacres, which we used to call race riots, or some of us scholars did. Now we more accurately refer to them as race massacres and racist white supremacist violence. There's a lot of that. And, when one of the motivations for this roundtable was we historians of this era kept getting asked, after the pandemic, there was the Roaring 20s. And journalists would say, that was really good. That's something we should look forward to, right? And then all of us in this conversation would say, no, actually, like the rise of the Klan, white supremacist violence, it just slamming the gates shut on immigration, all kinds of things in this era are deeply troubling if those are historical parallels that you're seeking to embrace as something that you...
Can I just interrupt you briefly, Chris, to really hammer home this point about how the Roaring 20s are not something to look forward to. First of all, it's important to remember that the measures that the Fed took to deflate the economy in 2021 created a massive wave of deflationary effects across the world that some historians have argued contributed materially to the political context that produced Nazism and led to World War II. So, let's not get all excited about the possibility of our economic technocratic overlords figuring out how to get the economy back on a smooth, productive line. The other thing I'd say about that is that, of course, inequality continued to grow all the way until 1929. So even, unemployment came down after the recession of 2021, but it never reached the kind of wartime lows that it had been at in 1917. I think it was down to like 1.2% or something. These are official numbers, of course, but in any case, I just think, and that the benefits of the Roaring 20s were, of course, widely divergent in who got to enjoy them. Not only because of the sort of systematic and institutionalized racism of the United States, as it was then, of course, still exists in many different forms now, but but it was also uneven in terms of region, in terms of employment category, and farmers really just got knocked about mercilessly for most of the decade. So anyway, I just wanted to really hammer that point home. Carry on.
If we get back to the immigrant communities for a moment, and I pick on you, Maddalena, for a little bit here, a couple of questions about immigration. What can immigrant communities and populations tell us about healthcare in the 1910s and 1920s, and also today in the 2020s?
I just wanted to build off of something that David said, and then I'll get back to your question, which is, for immigrants, it meant the 20s were followed by the 30s, which meant massive deportation and relocation of up to 1 million. We don't know, we don't have the numbers yet because don't want to check them, of Mexican and Mexican Americans, right? So even if you had a good experience in the 20s, I'm sure the 30s were not too fun for anyone. So one of the things that I've been struck, and I've been just racking my mind about this, is why immigration historians haven't written more about what was happening to these communities. And I think it goes back to, because they were so isolated and segregated, much of the information is in newspapers written in their languages, right? And so I remember one of the things that I didn't think I would find today, and then I ended up finding. But as I was reading some of Italian American newspapers, because they had no idea of what to do, how to react, and what the best practices were, there are articles after articles for weeks, for months on end, about these homemade potions, right, which clearly did not work. And so, despite outreach from local authorities, it's striking to me how much of that is still happening, right? So I think it speaks to kind of two levels of mistrust. One is the state authorities, but also the medical profession, right? Where people don't think these American doctors have your best interest at heart, right? And I will mention something that it's tangential, but I think it gives you a sense of what's happening. In a few years back in the United States, here in Minnesota, some anti-vaxxers targeted the Somali community, and they convinced them that they shouldn't vaccinate their kids against polio. And so we ended up having an outbreak, right? So you have the state history of, violence and mistrust and raids, which doesn't help, but the relationship with the health authorities isn't that much better either. And it's striking to me how similar the two situations are 100 years ago and today, and how much there's a reliance on homemade remedies, or even worse, toughing it out. And for example, for a lot of these communities where there are multi-generational, right, living in the same family, that meant raising your chances of infection. It also doesn't help that a lot of these communities live perhaps in not exactly state-of-the-art housing with very poor ventilation, right? And so you really see how this history exacerbated an already difficult situation once COVID-19 started.
One of the other things that I was thinking about, and I know that Chris and I had talked about this before, but I think your perspective, Maddalena, would be really useful on this, is, the flu in 1918 is referred to as the Spanish flu. There's this foreign component, foreign in quotation marks there, that it's conceived of as it's probably Kansas where it starts, right? But the United States doesn't think that that's the case. So how much does that factor in then in terms of how the disease itself is imagined in public consciousness? And then today, I mean, we recently moved away from naming variants by their geography, which was nonsense in the first place, but we're now naming it with Greek letters. So how have things changed? Have we learned? Have we, has it gotten better?
Yeah, so I was going to mention this earlier, and maybe we can all take a turn at some point about this. It's the willful commitment to ignoring any lessons from history, right? Almost right away, as in 2 years ago. So what's interesting about the Spanish flu, right? It was intentionally named that way because it was building on a long history of connecting disease with foreigners and foreign bodies, right? And by the time you get to World War I, there have been massacres, riots, attacks against immigrant communities, right? Mexicans had to be disinfected as they came through the border, right? But with the flu 1919 flu pandemic, there is actually, aside from the name, there's not a systematic effort to make that connection. And historians think that it's in part because there's something called World War I that was happening, and that pushing that too far would have actually undermined the United States' ability to fight in the war, right? But that doesn't mean that it doesn't pop up elsewhere, right? So by the time you get to 1921 and 1924, there are no qualms about making the connection between disease and immigrants. And in fact, by 1924, it's really, really hard for anyone with any disease to come into the country because the laws have become so restrictive. And in fact, I was just rereading for this roundtable, actually, the debates, they're obsessed with sailors because it's the one group that they haven't restricted enough, right? And so that's where you say, yes, that might have been why the flu got the better of us, because it was because of the sailors coming in and bringing it, right? I mean, was there any evidence of that happening? No, but they knew what they were doing. And by 1924, the World War I is in the past, and they can actually be explicit about that kind of language. Another thing, I don't know how far we want to take this, but this is also the height of eugenics, right? And so there, by the time you get to 1924, you see also, it's like, of course, they're the ones dying because they also have an inferior gene pool, which is one more reason why we need really stricter immigration laws so that we have as few of these immigrants as possible that could delete the racial makeup of the United States, right? And I think by 1924, it's clear that immigration laws are a tool of social engineering, essentially. And some of the legacy of the pandemic really helps drive home even people who had been skeptical, even big business, who knows that needs cheap labor, all of a sudden turns an anti-immigration.
Does anyone else want to come in on that at all, or?
I mean, I just add that it's utterly terrifying. I mean, to get away from our glimmers of hope, unfortunately, but it's utterly terrifying to consider the parallels in terms of not just the ideas, but even sometimes the language of white supremacist movements in the 1920s and the 2020s. The Great Replacement theory is, in effect, recapitulating a lot of these ideas that were popularized by people like Lothrop Stoddard and Madison Grant about, the rising tide of color, the replacement of the white race and white civilization by immigrants. And, it speaks to a problem that I think extends beyond the immigrant community, both then and now, which is the devaluation of particular populations in the context of both considerations of public health and considerations of political rights. I think the one group of people that I've been thinking a lot about in the midst of COVID is the prison population in the United States, which of course is, racially, in terms of national origin, disproportionately of color, and from immigrant backgrounds, these are people who've been exposed, in some cases, absolutely wantonly to COVID-19, and the prison population, obviously, in the United States is way larger now than it was in 1918-19. And I think it also speaks to the point that Maddalena is making about political opportunism, the use of pandemics in order to, even if you're collecting data, which ostensibly could be used to fight a pandemic and adopt rational public health policy to save lives. Instead, what it winds up being used for is propagandistic campaigns that actually turn people against each other for the political convenience and gain of the people who have sort of predetermined agendas, whether they be anti-immigration, whether they be in support of a carceral state, whether they be in support of expanding police forces, expanding access to guns. These are it's sort of bizarre how many seemingly unconnected to a pandemic or a public health concern issues can basically be people can ride on the coattails of the pandemic and the data that the pandemic is producing in order to further their agendas that have absolutely nothing to do with public health.
I suppose I'll just drill down on that same set of points, which are great and really thoughtful. To note that the first articles we can find that talk about a Spanish flu or blame Spain for the flu are in the British press, and they talk about the poor hygiene and climate in Spain. And it absolutely fits with what David and Maddalena are saying, this mixture of nationalism, of a sort of Anglo-Saxonism, eugenics, wartime nationalism, all overlapping to be weaponized. You see this in other countries, right? So the French blame the Spanish blame the French, the Russians blame the Germans, they also blame the Chinese, and they have their nomenclature related to this. So, okay, that shouldn't shock us. But that's all there very much dovetails with what's to come. And that's one of the points of the roundtable, that the aftermaths of this kind of language are unpredictable. And we are seeing some of these elements at work, this political opportunism, as David nicely put it. One other element that I think is interesting for us to reflect on, part of your question was about medical practices and what kinds of treatment different people could expect. And I also think that's interesting in this moment, our current moment, reflecting on 1918 and 19. If you look at the memoirs of major medical figures from this period, you look at their letters. In 1919 and 1920, they're searching for ways to construct a narrative, and they're pretty disappointed with how modern medicine has performed. Fast forward about a decade, they're now suggesting that 1918 and 19 was a moment that proved that modern medical practices were effective and useful, and that we should invest more in training, particularly sort of paternalistic kinds of models of medicine, more research. You see lots of claims that the need for more research so that the vaccines that were attempted to be made or serums that were attempted to be made could actually be put together in the future. So one of the things that I've been thinking a lot about lately is what narratives are we seeing emerging today about modern medicine, and what are the limits of those? What are the self-serving practices that we're seeing? What are the actual effects? So look, we've had the one glimmer of positivity. We've had the fastest global race to effective vaccines in human history, right? It's amazing. We've saved millions of lives with this, maybe hundreds of millions of lives. But at the same time, we've had terrible communication from public health officials. We've had a really uneven production and distribution globally, which is very clearly going to lead to further outbreaks, more mutations, and all kinds of problems. How these medical research and development narratives are constructed in this moment give us some sense of where we're headed. And I think there's a lot of this, I don't recall who said it, I think it was Maddalena, this sort of willful ignorance. We're seeing that operating a kind of guise or mist, suffusing this. And that's worrisome, because you did see some of that after 1918 and 19. And one of the lessons of 1918 and 19 was really about the limits of modern medicine and not making false promises. I mean, you can find in cities that are having super spreader events around the world, and particularly in the West in 1918 and 19, these claims that modern nursing and modern medical care would deal with this effectively. And then you see, thousands, tens of thousands of people die in those cities with those false promises made. It's headline news right there. So talk about why people, worried about misinformation, talk about why they didn't help their neighbors. Part of that was that medical communication. Part of that was the false promises. And we live with some of that today. And I suspect, it looks like we will see a whole lot more of that.
Well, when you said this, Chris, I was thinking about the Flexner report in 1910, which came out and basically reordered medical teaching in the United States and effectively closed a number of African-American and women's schools instead of teaching them clinical medicine, they're now teaching them hygiene. This is a willful attempt, a paternalistic and racist attempt to restructure medical training in the United States. And by the time 1918 comes along, we're seeing the consequences of it. Now, I don't know what the parallels are today, but it does seem like the vaccination programs and the rollout of vaccines have been tailored to certain demographics and willfully, as Maddalena says, ignoring others. So yeah, it's not a great parallel.
I think maybe the parallel to the Flexner report is the Trump administration canceling the pandemic preparedness division of the whenever that was, 2017 or 2018. There are all sorts of moments where there was sort of clear, and I mean that was a division that was set up by Obama. So in some sense, I think a lot of the consensus interpretation of Trump's canceling it was just like pure resentment at his predecessor. But I think one of the tricky things about willful ignorance is that it's not always willful, and this comes back to the question of what the frameworks for thinking about the reports that we're getting actually do to our reaction to that data or that information or whatever it may be, right? So I'm thinking here about an essay that was written by Harvard economist Robert J. Barrow, who's also associated with the American Enterprise Institute, very early in the pandemic, talking about the effectiveness of non-pharmaceutical interventions at lowering the death rate in 1918, 1919, and trying explicitly in the context of COVID-19 to take some lessons. One of the early conclusions that he has in the paper says that although non-pharmaceutical interventions such as school closings, prohibitions on public gatherings, quarantines or lockdowns could flatten the curve, ultimately, in most cases, they didn't actually reduce the total death rate or the absolute death rate over the long term. Now, a lot of people read the first half or the first passage of that article and immediately come to the conclusion, oh, this is convenient for me because I want school to be open. Like I want to be able to gather in public places indoors. Lockdowns and quarantines are damaging to the economy and we don't want them. But you read a little further and it turns out that his actual conclusion is that the reason the death rate didn't fall over the long term was that those non-pharmaceutical interventions were not sustained long enough. And that in fact, when they were in places where they were sustained long enough, the death rate did fall. And that's obviously what we've been seeing across the world. We've had this kind of real-time comparative study of how public health policy can intervene successfully in transmission. For some reason, even papers that are, at the cutting edge of research today are still being willfully misinterpreted, or perhaps not willfully misinterpreted. It's just people are only reading enough to get to the part where it says what they agree with, and then they stop reading and they just parrot it on Twitter and they reproduce it for magazines like The Atlantic and newspapers like the New York Times.
But you can see the kind of the negative consequences of like the hierarchy of who deserves care or who deserves vaccines, right, is spilling through other debates. Like I'm thinking about the formula crisis, right? People came out and said, you should not give formula to immigrant children, right? And that should be shocking, but it isn't, because it's in this context of, well, your lives do matter less, right? And another thing that the pandemic has done that was not the case 100 years ago is to normalize family separation, right? Even the 1921 and 1924 acts really disastrous immigration laws, explicitly racist. They aim to maintain family reunification. It was one of the only ways, right, that immigrants could still come in. That's disappeared too, and the pandemic has only exacerbated that element that was already underway before then, right? I mean, it's interesting to me how it's rationalizing and justifying things that we just in 1918, right? People took the streets in opposition to family separation, and now no one even bats an eye, right? It's just happening.
David, can I ask you a little bit about the argument that you make in the Roundtable about the political economy and about, I suppose one of the questions that I thought I would ask you is really about how do we sift out cause and effect? Because there's so much going on in 1918 and up until 1924, let's say, if that's where we want to call the end point of the pandemic. How do we sift out what effect the pandemic, the flu, has on labor, on economics? How do we sift that out from the war and the changing nature of American commerce and trade at that time?
I think it's really difficult, probably impossible, actually, with the information we have. I mean, it really, I mean, the answer to that, that's a very much a historian's answer to that question. I think economists will happily tell you that they can quite exactly predict to what degree the pandemic inhibited GDP growth. And in fact, Robert J. Barrow, the economist I just mentioned, has a paper that explicitly sort of pegs the damage to GDP by pandemics at around 6%, which interestingly enough, right, like tracks with the initial sort of average drop of GDP in 2020. In the immediate aftermath of the COVID crisis, before the beginnings of the recovery. Of course, the intervention, the state intervention and the monetary policy intervention, not only of the United States, but many states all over the world to that crisis, changes the political economic dynamics significantly in terms of, you know, how the pandemic relates to economic policy. But those policies that I was mentioning earlier in the aftermath of 1918-19, flu were really more geared toward the economic after effects of the war in most people's mind and in most of the historiography I've encountered. You know, these are the sort of the activities of the Fed, the policies then of the Harding administration to you know, cut taxes but raise revenue by expanding or lowering the income threshold at which you're taxed. These are policies that are all in the historiography related to after effects of the war, after effects of the labor militancy, which is itself related more to the war than to the pandemic, or really with any relation at all to the pandemic. And so it's quite difficult to actually pinpoint what role the 1918-1919 flu played in the political economic development of the 1920s, whereas I think in part because of the information gathering services we have now, and I think, you know, in some ways, just the fact that COVID preceded Russia's invasion of Ukraine, which now is of course, it's the other major political economic mover on the scene at the moment. You wind up, there's a sort of path dependency of reasoning that develops, and you know, I think it's been very difficult for me, at least, to find clear and persuasive arguments from a historical perspective that take into account political context and social context that identify what economic effect the 1918-1919 flu had. But Chris has actually studied this, I think, the flu and the comparative history much more closely than I have. So maybe he has an answer for us.
Well, I love your historian's answers, which I think is exactly right. You know, there's some fairly, I imagine you'll agree with this, but if you don't, maybe we'll have some good friction. There seems to be some good city level data. Not that that's perfect or ideal, because there's so much movement in and outside of cities. But if you look at cities that had serious non-pharmaceutical interventions and kept them on longer, you know, one thing I'm fairly persuaded by, at least by those economists in general who've studied this, suggests that the longitudinal effects of not having as many people die and be ill are pretty easy to measure at the city level compared to other cities that didn't do those things. So just a quick, you know, apples to apples, comparable cities, comparable population numbers, different non-pharmaceutical interventions. The city that held these on longer, generally speaking, bounced back a little faster. Beyond that, it seems like, you know, very clear empirical data that our economist colleagues would like to see doesn't really satisfy historians. The one other, I think, takeaway that's useful, this is...
I think a lot of urban historians would also be unsatisfied with the city-to-city comparisons for those same kinds of reasons.
Yes,
that, like, you know, I mean, even the phrase apples to apples as an urban historian raises my hackles a little bit, but not enough to disagree with the general impetus of your general direction of your comment.
It's a broad brushstrokes comment, but it seems like that one thing I've taken from that, and a lesson that I think historians can suggest to others, is non-pharmaceutical interventions work, right? Which you already said. Yeah. So, you know, it's a very basic one. But the other piece that I'm fairly persuaded by, and I'd be interested to know what you think. I've certainly seen in the last few years historians talking a lot about the differences between our economy now and then. Because there's been so much public discussion, and at least some of the
that came up in the roundtable as well.
Yeah, exactly, right. And so, you know, it does seem like we have a hard time making these comparisons for want of data on the one hand, and also because of the radical difference of our economy today. It often boils down to one phrase, and I guess I'll just throw it back at you, David. You threw it to me. The difference that we're now a consumer society, and the difference of having a consumer society versus that era's society, which didn't have the consumption and service models, the sorts of leisure activities, the delivery, even the concept of essential workers, which was there, but it's a wartime concept, right? And now we've imported that into a kind of pandemic war against the virus in the sorts of ways that Maddalena was saying, often ignoring who the exposures to those who are doing this essential work. Do you buy that? This sort of, it's the consumer economy difference fundamentally is a good way to understand why they're so radically different, 1918-19 and the 2020 onward?
I mean, I don't know. I think it's an element of that you have to take into consideration when you're thinking about, you know, whatever differences there are in terms of economic development, but it's certainly not sort of the skeleton key for understanding all the differences. And, you know, I mean, my tendency as a historian is to look to continuity. It's sort of a counterintuitive or maybe contrarian position as a historian. I think most historians are interested in how things change over time, but I do think that you know, a lot of this discussion that we've just been having has concerned the continuities between 1918, 1919, and our present moment. And I think when we get too bogged down in the sort of specifics of the shape of the economy, the sort of particular texture of labor as it exists today, as opposed to then, there are very important reasons to study those differences. I'm not sure that public health policy, when it comes to, you know, coming to conclusions about non-pharmaceutical interventions, are really the reason that we want to be identifying those differences, or that they make much of a difference in terms of viral transmission. I don't think that was necessarily where you were going with that, but yeah, I mean, I think on the other hand, there are some very important differences between that moment and our own moment, considering questions of how the aftermath is, you know, if we're going to call it that, is going to play out. One of which I would say is state capacity to intervene, both in terms of public health and in terms of questions of economic inequality and the development of the economy over the next 10, 20 years in the US. And we're facing a whole bunch of different crises that are interwoven with that, not least of all the climate crisis. And you know, I do think that thinking about the differences of state capacity can either be something that leads us to optimism about the possibilities for actually redressing injustice and intervening powerfully to make the world a better and freer and more equal place, or it can terrify us because for all of the reasons that I think Maddalena has spoken to most eloquently in this conversation, the state is primarily, seemingly these days, interested in acting for the benefit of an abstract idea of economic growth to the detriment of the environment, to equal rights, to safety, and certainly to the well-being of all people equally.
That's an interesting point, David, but I wonder, do businesses, do they act in the same way as the state does? Because it seems that they're becoming a bit more conscientious about how staff work in a way that I wonder, were they thinking the same way back in the early 20th century, thinking about work in the same way? I mean, we've seen resignations in the 2020s in a way I don't think we would have seen in the early 20th century. We work in a different way now. And also there's a corporate responsibility. Now, I'm not saying that I don't want to, say too many kind words about big businesses in the 2020s, because we could very easily call this the second Gilded Age. But in the same breath, there is more social responsibility perhaps now, in a very imperfect way. So what are your thoughts on that?
I'm not sure. I feel like, there's some conflicting literature perspectives on that question. I think, I spent some time last year tracking donations of big businesses, and the way that, I think if you look at the historiography of money in politics over the last 40 years, it might make you more skeptical about the question of corporate social responsibility beyond a set of strategies that really did emerge in full force in the 1920s of corporate branding. And, there's the Roland Marchand, the classic Roland Marchand literature on this, creating the corporate soul. Big businesses tried to market themselves and began really a greater effort in the 1920s to market themselves as paternalistic. They sponsored company unions. They sponsored outings. General Electric was actually a forerunner of this as a company in the do we call them the noughties, the 1900s and teens. But so it was going on in some sense that, this was percolating already before the 1920s. But yeah, I think actually a lot of the dynamics of the more the nastier dynamics that you're sort of alluding to without specifically citing of the 1918 to 22 moment. We're not in quite the same political moment today where big business and finance had really refurbished its image over the course of World War I as a partner with the state, and had recovered a little bit from some of its, the industrial relations hearings of 1912, the sort of 1912, 1914 period really made business look bad, and labor militancy existed for a reason, and labor violence was quite widespread. And certainly in 1919, as Chris already referred to, right, you had the Seattle General Strike, you had the U.S. Steel Strike, you had the United Mine Workers Strike. Then the reaction from the state, in part, is quite aligned with business reaction and kind of violent anti-communism. And I'm afraid that when I think about our contemporary moment, I see a lot of parallels in terms of the kind of politics of violent repression of any kind of left, or not to speak of socialist politics, which of course is like the sort of horizons of political imagination in 1918 through 1922 were exploding in a much more dramatic, at least rhetorically speaking, way than they are today. And yet even the sort of most milquetoast attempts of leftists in our own moment to make some inroads in Democratic Party politics. You're even talking about potentially a more receptive group of people are being denied in significant ways. And I think actually looking over the roundtable before this conversation, even 6 months ago, I was more optimistic about the possibilities of the Biden administration in terms of passing real legislation to make inroads against inequality. And I think that is being driven a lot by big business and the priorities of big business.
I couldn't agree more. That was really the heart of what I wanted to get to, that you said far more eloquently, is that big business seems to be, in working in lockstep with the state now, in the way that they maybe given it was wartime or even post-war time, the state seemed a much more powerful and autonomous entity than it does today, even if you just follow the money. What other approaches, and this is a general question for everyone, what other approaches do you think we can take to the history of pandemics? Because obviously the roundtable took various approaches, and of course we haven't been able to include everyone that was part of the roundtable in today's conversation. I was just wondering if you think there's some avenues. I know we've seen, we talked a little fleetingly about the environment perhaps, or, we've kind of talked around medical history. We know it's there. It's obviously the elephant in the room when we talk about a pandemic, but what other approaches do you think might help us better understand the impact pandemics on all aspects of human life?
I mean, one issue that came up or one suggestion I think that came up in the roundtable, in the published roundtable, was to focus on individual and intimate experience of the pandemic in families, in sort of closely defined communities, and really trying to get a texture for and then be able to reproduce as historians in an evocative way the suffering that pandemics actually produce on ordinary human beings, and to convey that in a real sense. I think this, that is the kind of antidote to a much more data-driven approach to understanding pandemics that I think oftentimes yields numbers that are so huge as to be meaningless. I mean, I'm not entirely sure how many people really feel the impact of 1 million dead from COVID in the United States, or feel the impact of, well, the official numbers say it's over 6 million now worldwide, but actually the WHO just issued a report suggesting that excess death was closer to 15 million worldwide, and that COVID seems likely to have been either the direct or ancillary cause of that excess death. Once you get into numbers like that, it starts taking on a dimension that our brains can't quite process, and potentially then does not actually motivate activism, that the kind of collective action that would lead to better policy. Not that history necessarily needs to be focused on leading to better policy, but I think.
So we're not taking an interdisciplinary approach to things. We need to wait for that book, Love in the Time of COVID. Right?
I think ultimately I am with Marx on this, the early Marx on this question, that the point is to change it.
I do think that there is a need to humanize, right, the people who have been affected. I've been thinking a lot, even since writing for the roundtable, about disability studies, especially with long COVID. If it's really indeed the case that 1 in 5 of people infected with COVID will be affected in the long run, I think it's going to change a lot of different aspects of our lives, right? I don't know that we can wrap our mind around that, like life, work, political engagement, everything will be different, right? And I wonder, if we write that history, even for 100 years ago, right, through disability studies lens, what else would we learn about that experience?
That's a great point, and I had just written down what about that. There's some solid scholarship, rather obscure, on long flu, and the placing of people in different kinds of dementia wards and other facilities in 1918, 1919, 1920, and how that seemed to correlate in Western Northern Europe with where there were larger outbreaks or higher case rates, and then it disappears in the literature. You can't really find anything by historians, and no one was tracking that stuff. So there doesn't appear to be data, at least no one's looked for it. There doesn't appear to be, but that's illuminating in what we might be facing, which some public health officials have been talking about, which is, having kind of permanent COVID facilities, right? And very few people are grappling with that. You see that almost none in the political discourse in virtually any country's media that I'm aware of, right? But this could be one of the most enormous, human costs of this. And then back around to David's point, I mean, I think this roundtable and the previous one that I helped to organize really, for me, foregrounded how we need to think about 1918 and 19 in personal terms, to microscope and telescope out in the way that David was suggesting and the roundtable suggests, to look at individual cases to give us more of a nuanced sense, because the numbers and the reality of this catastrophic pandemic in the midst of a wartime situation in which it's so deeply embedded make it almost incommensurable. So we need those individual stories. The other thing is to think about what they mean longitudinally, the trauma, personal suffering, right? The guilt, the contagion guilt, as Elizabeth Outka as a literary studies scholar has talked about in her book, Viral Modernism, people who live through this, you can see contagion guilt in literature and in art. They lived through it and they're guilty because their brother died, their parents died, their children died, right? And or were horribly, their lungs were horribly scarred and they could never, participate in life in the way that they could before. These are things we haven't thought enough about, even though we've been living now into a third year of this pandemic, and the historical literature suggests when you look at the individual cases, how deeply traumatic this was longitudinally. I mean, these are families that are wrecked. And as David said, look, we're over 1 million deaths in the US. That's now we're roughly 1 in 350 Americans have died. It feels like we should be able to pause and reflect on that suffering and trauma. And yet nationally, it's eerily similar to a nation that didn't mourn those deaths in 1920, never memorialized them really.
This is what I meant though by subsumption of
the
the pandemic, right?
Yeah,
like the subsumption
absolutely.
rather than the end. It's all being subsumed. I mean, less so I think now, and Alan made that point in the roundtable that I think it's difficult to imagine a roundtable of historians 100 years from now saying, how come people just seem to forget about COVID? It doesn't seem likely that that's going to happen, although it could be. But in any case, the politics of the moment are taking priority in terms of how policy is being shaped, and in an indirect way than how the pandemic is actually playing out. And I think, unfortunately, it's very dangerous. And as Maddalena said earlier, it's sort of this refusal to learn from history seems to be very much in evidence. I would just say, from my contrarian nature, make one point about the potential dangers of individualizing or focusing too much on suffering, which is that it can be politically paralyzing. And I do think that some of the stories that we need to think about and histories that we need to look for are histories of organizing around self-care in communities, around mutual care, around collective care, and then around collective political action to actually transform public policy in productive ways. And I have no immediate examples to hand, but having been a social and political economic historian long enough and a labor historian long enough, I know they're out there.
I think that is so important. And that's a really good message for students, that because I think one of the things that you've all talked about, and I think it's something that we all teach about, is empathy, and how critically that's important for a historian to have when you think about the past. But actually, what you're saying as well is the added dimension to that is that you need to be active. You need to be an activist as well, and I think that's what many of us as historians are in some way. We're writing about things that we have a passion about. David, I wonder if your comment though about 100 years from now, if that is famous last words, like that. And I really wanted to ask Chris this, because Chris has been doing the comparisons for quite a while now. And, there's a war on now. There was a war on then. Now, maybe the Ukraine-Russian war isn't going to come to dominate post-COVID histories, but we've got a cost of living crisis that probably is going to be with us for a long time to come, I would think, or at least the inflation will be. And there's a number of things that are quite worrying that are going to be stealing our attention, not least an election this year, midterm, fair enough, but there's, 2 more years as a presidential election. Are we going to lose not just the lessons, but the memory of COVID, with all that is to come?
I mean, I feel much more comfortable making predictions about the future 100 years in advance rather than 10 years in advance. Because I'll be dead by then, and nobody can be around to point their finger at me like Nelson and say, ha ha.
They're going to resurrect this podcast, David.
Yes, I'll be embarrassed for all eternity.
Well, I suppose just to counter the point that Alan Lessoff made in the piece, and that you seem to subscribe to, David, I can very much imagine in 100 years historians getting together and COVID being next to nothing in the greater scheme. Particularly, I think some of the things we've been hitting on a lot here, the unequal impact, I can imagine that disappearing within a decade. I can imagine people not being very concerned with the fact that a lot of communities in the US and around the world, maybe never got distribution of vaccines. And that just be eliding into, a longer history of this is sort of what I was implying a longer history of a kind of medical triumphalism, research and development triumphalism, big pharma story, plus, humanitarian, vaccine diplomacy that got some certain success rate that people plant their flag and declare victory on. I think those are some elements of this. I suppose the bigger question that Mike's getting at is, okay, so we've been talking about 1918 and 19. Never has history seemed more relevant, right? I mean, people were crying out for this, Gilded Age and Progressive Era historians, to talk about this. And I'd been peculiarly interested in this from research I did a million years ago on what was going on in World War I in this moment, and the elections that they affected, the midterm elections of 1918. In particular, I was interested in something David slightly alluded to. What happened to American socialism in 1918? How come Eugene Debs, the great American socialist, had such a hard time campaigning in a bunch of places? And I realized that it was flu was the primary reason. And then he gets sent to jail for speaking out against the draft. Hey, wartime suppression of free speech. We've got a full sort of narrative there, right? But yes, they could hold midterm elections even with a virus rampaging, even not knowing what we now know. We'll now be seeing a second election, as you're suggesting, Mike. I mean, I think, in 2024, if the mutations aren't too terrible, will there even be masking required inside for those who are voting inside? I doubt it, right? In the way that it would have been absolutely required in 2020. And, so I don't know if that's a good answer. It's just to say that, that we've seen this exhaustion with everything related to the pandemic. Certainly that is evident in the historical record in 1918 and 19. But the lessons of that have not been learned well at all. We can look at the cities and states that eased off their restrictions earlier in the US, and we know that they did worse, generally speaking. Some did okay, but more like out of luck than out of science or any rational sort of public health policy. We've seen states, I think the other thing about data, this is a winding answer, but the other thing about data that will be interesting is in some point we are going to learn that the cities and states that were wide open throughout this in the US, we will learn a lot more about who suffered most, right? About their economies, about a whole lot of elements of what's gone into that. We can only surmise right now what that will look like. We're not, there's some decent preliminary analyses, but I think in 2 or 4 years, we'll have a much better sense of that. And that may then inform future pandemic public health policy and state politics. It'd be hard to imagine a state like Florida staying as wide open if there are definitive studies that across the political spectrum you could point to as saying, older conservative Republicans, for instance, were dying in much larger numbers than younger liberal Democrats, right? So intensely political, I'm saying it right down the middle, because they would know that they were killing their constituents if people agreed to that, right? We don't yet have the fulsome information related to that.
I think you're underestimating the American death drive, Chris.
It's true. But I'm also trying to potentially overestimate the political incentives in that situation. Anyway, that's a winding answer, Mike. I'm not sure where you were going with the question.
Well, I don't know where any of this goes. I guess that's my point. None of us really do. Anything can happen in the next few decades that could change our view about COVID. But I think what you've given us today, everyone, is a really clear idea about the rhymes and rhythms of history. We've talked a lot about continuity and change. We've talked a lot about empathy. And these are core components about what historians do, and the usefulness of history, I think, as a discipline or as a trade, I guess, to inform the future. And I first of all want to thank you all for that, but I also wanted to offer everyone an opportunity to just say one final word, because we're getting close to 80 minutes here, and listeners will stay with us for a while because you're all very compelling. But if you had to wrap it up, what would you say about the long history of the Great Flu and where we are now?
Nobody wants to take it first.
I mean, that's a hard question, but I thought someone might like to say something about their piece in the Roundtable, or the Roundtable as a whole, and its usefulness, really.
I mean, I don't know if this is going to come out coherently, but just to sort of try to answer that with reference to this little mini dispute that Chris and I got into at the end, where I took Alan Lessoff's side on the question of historians 100 years ago not being able to gather and identify COVID as a sort of major mover of history in the historiography that proceeds from our current moment. I do think that we've seen a quite different scale of state intervention in the economy in immediate reaction to COVID than at least I have encountered in the literature in terms of state reaction to the flu of 1918, 1919. And when you think particularly just in the US, I mean, this is, probably can span worldwide, but particularly in the US, the recovery packages that were passed and the stimulus checks that were sent out, among other things, nearly cut child poverty in half very briefly in the United States. It was some of the most ambitious social legislation in the United States since the 1960s. And that was because of COVID. And my hope is that actually that, as I said in the roundtable, some of that reactive policymaking to COVID in the initial moment, some of that better, more salubrious policymaking will actually open people's eyes in terms of the political possibilities of what the state has the capacity to do when it's oriented toward protecting people and ensuring their safety and their health without regard to and one wishes that this were the case. Of course, I mean, I think future studies of the stimulus legislation will identify that there were all sorts of people who were left out, and that it was actually systematically racist and sexist, and they didn't reach people that were in particular employment categories. But I do think that identifying that the state can be a force for good after 50 years of neoliberalism has the potential to actually open a bunch of people's minds about what collective action can yield around questions not just of public health, but of economic justice, racial justice, international justice, and economic justice.
One of the things that keeps me up at night is actually the intersection of pandemics and climate change. And the fact that we're headed towards a time where more and more people will be displaced, right? And so I wonder if we'll even have the luxury to forget COVID-19, because it seems that the intersection with climate change will not allow us to do that. What we do with it is, right, because it could be seen as a moment of opportunity and solidarity. I don't know. I hope it is, but I don't know, right? I think we've seen both the best and the worst of what we can do. But I do think that it might be a bit more difficult to forget COVID-19 than it was 100 years ago about the flu, right? In part because that it's clear that that's where we're headed, right? There's going to be more crisis. And I would hope that this is a moment that pushes us towards more collaboration rather than less collaboration. But I honestly don't know. I wish I had a more polished answer, but this is something that I have been thinking a lot about, honestly.
Yeah, I mean, one of the motivations for the roundtable was to explore dimensions of aftermaths of that pandemic and just tease out some of these possible connections from really skilled historians who know a lot, and also recognizing the unknowability of what's to come, and even looking at the historical record and seeing the serially wrong predictions around 1919 and 1920. I mean, that's illuminating in and of itself. Yeah, one thing that comes out in the roundtable that I think is useful to just ponder for a moment is the near universality of some experience of COVID today. I don't know what that portends. It could be for better or for worse, but it is interesting to think that around a globe with nearly 10 billion people, we've all experienced a pandemic in the last few years, everyone who's still alive. And what that might mean for solidarities, what that might mean for, a kind of potential for change or a recognition of the limits of the structures of their societies. There's a lot there that you could unpack. The pandemic of 1918 and 19 doesn't appear to have been quite as universally felt I don't know why that would be. I think part of the literature here is that we don't have great global histories of that pandemic. The questions weren't being asked. You'd asked about data. The documents aren't fully there. I suppose you could tease that out more, but we do have that today. So that's one thing I've been thinking a lot about. And the other element is historical analogies. If you look at the people in my sector, I do the U.S. and the world and foreign policy. People are talking a lot about the Cold War. What version of the Cold War are we living in now? The Russian invasion of Ukraine, or is it some earlier era that's a better comparison? Obviously we're talking the 100-year comparison, the end of the progressive era, this pandemic. But if you're thinking other global relations, is this more a moment of dislocation like the 1890s? There was 1889, 1890 was another pandemic, another flu. That might have been why some of the older people in the population actually had immunity in 1918 and 19. And if so, what does that say? The sort of scramble for colonial acquisitions, rising nationalism. If you want to play that out, does that lead to the kind of global integration that we saw by 1914, but that also led to the conditions of a world war? The kind of insular politics of that era, which had both this progressivism that we're all really conversant in, and also this reactionary politics of conservatism. Those feel really palpable to me and much better analogs than Cold War stuff that we hear a lot about. So, I guess that's a call for why we need a podcast like this, studying the Gilded Age and Progressive Era, because maybe those are the best kinds of comparisons for us to consider.
Well, I think I should just leave it there. For all of your hesitation, everyone paused there. And in terms of concluding remarks, I don't think we could end it any better. That was wonderful. Thank you all so much.
Well done, Michael.
Yeah, thanks so much.
Thank you.
Well, that's all we have time for. Thanks for listening. You can follow the Gilded Age and Progressive Era on Twitter or on my website, michaelpatrickcullinane.com. Please consider subscribing or reviewing the podcast wherever you listen, because it really makes a big difference and helps direct others to the show. I hope you'll join me again for the next episode.